So when we think about innovative healthcare is currently the biggest area of interest in the fund, and so it hence represents our biggest bet. Well, we call it innovative health because we're really looking for companies here that can improve medical outcomes for their patients, so it can ultimately lower the cost while extending life effectively. When we really drilled down into this area, 4 or 5 years ago when we first looking at it, the companies that had the best characteristics for us were really the life sciences and diagnostics companies, because those were the ones that effectively did the testing to help early prognosis of disease, and also were the ones that helped build the new drugs, the biologic drugs that are doing a lot of this personal care or some of these improved outcomes. The second area we really liked was medical devices. Medical devices were doing better just because the technology was getting better. They were getting smaller and becoming more useful, and hence you could sell a smaller, more useful product for more because it would provide an improved outcome for the client. What we've seen more recently with the onset of COVID is we've really doubled down on this area because COVID has effectively added a huge new TAM, or a huge new addressable market for these companies. And the first and most obvious area here is COVID testing. The solution to COVID, I think we all know, is to test aggressively and to track and trace. And when we look at the testing TAM, so far this year it's pushing up towards a $30 billion per annum industry. And there's really just a few companies here that are taking advantage of this. The first is obviously Thermo Fisher with their PCR tests, where we think they have nearly a 50% share in COVID testing at the PCR level. And on top of that, you then have Abbott Labs, which is the antigen test, which is this rapid test. The market is essentially assuming this testing market will only last a year or two. We think it lasts much longer than that. Not only because countries are now testing aggressively, but also corporates are going to have to test aggressively as we all start going back to work. The second big TAM that's been added since COVID came along is really for vaccines. So we all are hopeful that a vaccine will be developed. There's actually 6 in phase 3 development today. And when they are approved, and we think they will be, ultimately they need to be built. And so we see a world where, potentially up to 7 billion vaccine shots need to be produced, and potentially have to be produced every year or with a booster over a long period of time. And here, rather than look at the company that might make that vaccine, what we're actually looking for is the shovels or the weapons manufacturers in this war against COVID, the people that build the biological tanks, that build the equipment that are effectively going to make the vaccine. Here we also see nearly a $30 billion TAM, and that really leads to companies like Danaher and Lonza. And so those really do make up the largest part of that innovative healthcare area. They are companies that we think can win from the testing, can win from the vaccine, but then lastly and most importantly, they're going to win because this increased healthcare spending is going to take on the sorts of military spending as we prepare the world to avoid the next pandemic. And so we think this spending could last a very long period of time. Last stock we wanted to highlight here amongst that group, the one stock we would highlight is Thermo Fisher. Thermo Fisher is the one that participates across all of those spectrums I just spoke about. It's effectively the Amazon of healthcare, and the fact that it is interested in all these different areas. We see strong structural growth ahead for this company. We see a minimum of 15% per annum earnings per share growth, regardless of how the COVID crisis evolves from here. And more importantly, you are actually getting that at a reasonable multiple today of just 26 times forward earnings. And so that is our biggest bet here. Danaher would be the second one, and Lonza and Abbott would be the third and fourth respectively.